largest cause of sudden cardiac death is coronary artery disease. So whatever are the risk factors for coronary artery disease like smoking, high blood pressure, diabetes, and positive family history, diabetes, obesity, diet which is too high in saturated fats, in trans fats, central obesity, all these risk factors are applicable to risk factors of sudden cardiac death also, whenever we are looking at age more than 35. But in young people like athletes, you must have heard sometimes athletes dying. They have some congenital disorders like channel electrical abnormalities or heart muscle disorders. So taking a good family history is very important whenever we are looking at sudden cardiac death. And as I said earlier, risk factors of heart attack and coronary artery disease are primarily the risk factors for sudden cardiac death.
Okay, doctor, perfect answer. 1 minute 30 seconds. Your second question, does cholesterol accumulate right from the early age? Do people have to worry about high cholesterol in blood only after a certain age?
See, there is a condition called familial hypercholesterolemia, which is pretty common. 1 in 500 individuals have. And those families who have heart attacks in younger age, say less than 55 years of age, they could be harboring this gene for familial hypercholesterolemia. So we need to actually at times study the siblings and offsprings of patients who have heart attacks at young age, or whenever we deal with families where clustering of heart attacks at a young age is there. In such individuals, precautions for high cholesterol have to be taken early in life. And as they say, actually, the seed for this particular disease gets sown very early in life. So, children of patients with heart attacks and those who have familial dyslipidemias, because 80% of the cholesterol or fat that we have in our blood is genetically determined, and 20 to 25% only is our diet related. So that genetic component is going to remain in young and elderly people. And if we can catch them early, we can institute various preventive measures in them at an early age.
Okay, perfect answer, doctor. 1 minute 30 seconds. Now the last question: how does the long-term cardiovascular risk of patient with type 2 diabetes mellitus compare to non-diabetic patient with first myocardial infarction?
Diabetes mellitus is, as you all know, is very common in our country. And it is said that India is the capital, world capital for diabetes. We have this central obesity genetically, because of which we have insulin resistance syndrome. And one of the highest prevalence of diabetes is seen in South Asians across the world. Now, diabetics patients pose a special problem to us and to physicians because patients of diabetes have painless heart attacks. So they may not get to know that they had a heart attack. That is the first thing. Secondly, the disease tends to be more diffuse. The heart arteries are called as coronary arteries, and the arteries of a diabetic patient with heart attack, actually, one has to see to believe that they look very different, and all doctors know it, that they look different from non-diabetic patients. So firstly, disease occurs early, disease is diffuse, it is painless, it carries a greater amount of risk of life, and also subsequent complications are more. Also, diabetic patients, they do not fare as well after angioplasty, stenting, surgery as non-diabetic patients do, because they have an actually vascular abnormality which is very diffuse. So we have to take extra precautions in diabetic patients, and good sugar control and all the other precautions have to be more important in diabetic patients who get a heart attack as compared to non-diabetic patients when they get a heart attack.
Perfect answer, doctor. One last extra question, if time will allow, then anchor will ask you. Anemia can be temporary or long term and can be range from mild to severe. Anemia can lead to many serious complications. Does anemia increase the risk of heart failure?
Well, definitely anemia is very important for us as a country because the prevalence of anemia is very high in our country, and iron supplementation, our diet is also deficient in iron. So whenever heart patients have anemia, we call someone to be anemic when the hemoglobin is less than 11.5. And women, especially in the menstruating period, in the childbearing period, more often have anemia. And patients of heart disease, whenever they have anemia, it puts an extra load on the heart. Because you see, the heart pumps blood to the whole of the body, and hemoglobin actually is the carrier of oxygen in the blood. When hemoglobin is less in anemia, hemoglobin is less. So when hemoglobin is less, obviously the heart will have to work more. So the heart starts beating faster. Heart has to pump out greater amount of blood. So as you said, in heart failure, when the heart functions are compromised, anemia puts an extra load on the heart. And definitely correction of anemia is a very important component of treatment of any heart ailment.
Okay, doctor, the answers were totally fine. And I will, according to your answers, I'll make the pointers, and then I will share the pointers with you so that you know what is going to come on the screen. And I have also recorded your video. If you want to rewatch it, you can rewatch it. And
You send it on WhatsApp?
if you no, we can't share it on the WhatsApp, but we can share it on the mail or in the Skype itself.
जैसे भी आपको ठीक लगता है मेरे को भेज दो।
ठीक है सर, मैं आपको स्काइप पे शेयर कर दूंगी अभी।
ठीक है।
ठीक है। और
स्काइप पे शेयर हो जाता है?
हाँ जी, स्काइप पे शेयर हो जाता है।
अच्छा अच्छा, ठीक है मैडम।
एंड वन मोर थिंग डॉक्टर, लाइक फ्राइडे को आप लाइव जाएंगे 1:30, तो बिटवीन 11:30 to 12:30 आपका एक और बार टेक चेक होगा, सिर्फ 5 मिनट लगेगा। अगर आप बिजी हैं तो आप अपने असिस्टेंट या फिर किसी को बोल सकते हैं कि वो कॉल पिक कर लें, और इससे 5 मिनट।
तो अपना लाइव कितने बजे? 1:30 बजे?
हाँ जी, 1:30।
1:30 तो हम 1:15 पे लॉगिन, मतलब रफली 1:20 पे लॉगिन कर जाएंगे, है ना?
हाँ, वो तो आप लाइव के लिए लॉगिन कर जाएंगे, पर एक बार टेक चेक होगा,
एक बार टेक चेक
5 मिनट लगेगा।
कोई इशू। ठीक।
तो आप बिजी होंगे तो आप किसी और को बोल दीजिएगा, फोन पिक कर ले बस। ठीक। ओके।
राजा जी के पास आपका नंबर है, तो वो राजा जी कर लेंगे उसको।
हाँ जी, बिल्कुल। और एनी अदर क्वेश्चन और समथिंग एल्स आई कैन हेल्प यू विद डॉक्टर?
बस वो आपका कंपेयर कौन होगा उसका वो बता दो मेरे को, कौन है?
हाँ जी,
जो आपका कंपेयर होगा वो कौन होगा?
उसका फीमेल है, ये तो पता है मुझे, पर अभी 3-4 है, मैं आपको बता दूंगी कौन सी होंगी ना व्हाट्सएप पे।
ठीक है जी, थैंक यू सो मच।
या गुड लक डॉक्टर, थैंक यू।